Since the creation of the United States government has had a series of policies that sometimes very inconsistent with regard to Indian tribes and Native peoples in this country. So years of federal policy, including removal and assimilation, and now lives on reservations in Indian country throughout the United States, has led to a change in the way that we live and the way that our governments operate, but also the ways that we eat.
When that happens, foods change. And in many cases, when those removals and relocations and terminations were happening, other people's foods were substituted for what were our traditional foodways.
Places that were our Aboriginal territories, and where we knew what to eat and what to hunt, what to gather, those things were now changed by the trauma of removal to a new place.
We've gone from peoples on this continent who had deep ties to our foodways, and throughout the course of history have been continually separated from those foods.
Our opportunities now in our new homelands, where our tribal leaders have sometimes asked the question, do our people have enough food to eat? And that question has sometimes been answered with solutions through federal commodities programs or other sources of food that we're now finding out have been very unhealthy for our bodies.
There's history associated with this separation from our foods that's deeply tied to federal policy, but it's also deeply personal to every tribe.
Type 2 diabetes is an enormous problem throughout Indian country, and that's now manifesting itself not only through our elders and our adults, but also our children.
Traditional food is culture. It is everything about us. It's deeply intertwined with our ceremonies. It's deeply intertwined with our languages.
When we were stronger in our foods, we were healthier as a culture and healthier as a people. And we can be strong again through our foods.
Our tribes must work together in a cooperative effort to change policies on the foundational, but also on the tribal and federal levels.
Well, food deserts are defined under federal law to be any time that a community is separated from a potential food source, such as a supermarket, a grocery store, by 10 miles. But if you actually do an overlay of food deserts as defined in federal law with all of Indian country, every place in Indian country is a food desert.
There's no one fix-all answer to these problems. It's going to take addressing them from multiple points and from us all banding together.
All we have to do is decide that no longer will we be separated from our foods. No longer will we be separated from our traditional foods, but no longer will we be separated from healthy foods. We have to regain our health. It's central to the survival of all of our people. And we have to do it for ourselves and for our children and for our grandchildren, and now is the time.
We stand on the solution.